and then I'll actually formally start the meeting. Brilliant. So I'll make a start now. So about to start the meeting formally. So I don't know whether we've yet started recording the meeting, Shane?
Yes, Chair, it's live.
It's now live. Okay, that's brilliant. So thank you. So welcome everybody to the Sandwell Health and Wellbeing Board. Just to introduce myself, I'm Ian Sykes. For those of you that don't know me, I'm a GP in Sandwell. I'm the chair of Sandwell and West Birmingham CCG. I'm vice chair of the Health and Wellbeing Board, and I'm chairing the meeting tonight in the absence of Councillor Crompton, who's unable to attend. So thank you very much, all of you, for attending. If I can ask all of you, please, to mute your microphones and turn off your video cameras if you've not already done so, unless you've been invited to speak or that you're presenting. Simple housekeeping: if anyone wishes to speak, then please use the hand raise function or put a message in the chat, and I'll do my best to try and keep an eye on that, and then invite you to turn your camera and microphone on when you speak. When you finish speaking, please turn your camera off and turn your microphone off. Now, I've been asked to just list the board members and everybody on here to introduce themselves. What I'm going to do is take Chair's liberty and say what I'll do is if I go down the attendance list, and I'll actually ask everybody on the attendance list to introduce themselves, and hopefully that way I won't forget anybody. Shane or Claire, if I did forget anybody, please let me know, or if you admit anybody to the meeting after I've gone down through the list, then please let me know. So first of all, I've introduced myself, Ian Sykes. I'm now going to go down the list. So Dr. Ayaz Ahmed, you just briefly put your camera on, a couple of seconds, introduce yourself, and then I'll move on to the next person.
Hi everyone, Ayaz Ahmed, a GP in Wednesbury and one of the GP directors at Sandwell and West Birmingham CCG. Thanks.
Thanks very much. Christine Guest.
Sorry, just sticking on my microphone. Chris Guest, I'm a service manager with the adult social care in Sandwell with responsibility for commissioning.
Thanks very much, Chris. Claire Norton.
Claire Norton, I'm a Commissioner for Adult Social Care for Sandwell, but I'm also currently covering the Interim Health and Wellbeing Board Project Officer role.
Thank you very much, and I hope I don't get anyone's titles wrong, but if I can introduce Councillor Elaine Giles.
Hello, Councillor Elaine Giles, the chair of the Health and Adult Social Care Scrutiny Committee.
Thank you very much. Councillor Farrut Shaheen.
Yeah, hi, Councillor Farrut Shaheen, Cabinet Member for Living Healthy Lives.
Thank you very much. Marsha Foster.
Afternoon, everybody. I'm Marsha. I'm the Director of Partnerships for Black Country Healthcare.
Great, thank you very much. Dr. Priyan Hallan.
Hi, Priyan Hallan, GP, Sandwell.
Thank you very much. Lucy Heath.
Hi, Lucy Heath, Academy Director of the Black Country and West Birmingham SDP, and I've come to present one of the agenda items today.
Thanks very much, Lucy, for joining us. John Taylor.
Hi, John Taylor, Chair of Health Watch Sandwell. Thank you.
Thank you very much. Karma Booth.
Hi, I'm Karma Booth, Head of Strategic Commissioning and Partnerships, Sandwell Council.
Thank you very much. Keith Alcock.
I am Councillor Keith Alcock. I'm the Cabinet Member for Homes.
Sorry to apologise, Councillor Alcock. Thank you very much. Leslie Hagar. Leslie Hagar.
Hello, Leslie Hagar, Executive Director for Children's Services at the Council.
Thank you very much. Lisa McNally.
Evening, Ian. It's Lisa McNally, Director of Public Health for Sandwell.
Thank you very much. Mark Davis.
Hello, Mark Davis, Chief Executive at STVO, Voluntary Sector Umbrella Organisation for Sandwell.
Great. Nikki Denston.
Hi, I'm Nikki Denston. I'm Service Manager for Business Excellence, and I'm presenting the item on community wealth building this evening.
Oh, fantastic. So when I come down to that, I might introduce the wrong, if I introduce the wrong person, I apologise. So thanks very much, Nikki. That's the item that's down under Alison Knight, isn't it?
It is, yeah. Unfortunately, Alison is double booked this evening.
That's great. Let me just put your name in there then, just so I don't get it wrong. That's great. Thank you very much. Terence Reid.
Hello everyone, it's Terence Reid, Partnership Development Manager for Sandwell West Birmingham CCG, and I'm co-presenting with Chris on the social prescribing update.
That's great, thank you very much, Terry. Shane Parks.
Shane Parks, Democratic Services.
Thank you very much. Stuart Lackenby.
Good evening, everybody. Stuart Lackenby, Director of Adult Social Care.
Thanks very much, Stuart. Tricia Newton.
Tricia's live broadcasting for us, Chair.
Fantastic. Okay, so welcome, Tricia, and thank you very much for doing that. And I think that's all the list of attendees I've got down here. I apologise if I've missed anybody. Is there anybody else attending this meeting other than just listening as an observer who I failed to mention?
I think we've just received Michelle to the meeting.
Oh, fantastic. Right, Michelle, if you're there, can you introduce yourself?
Hi, thanks Ian. Sorry, jumping from one meeting to another. Sorry, I'm a little bit late. I'm Michelle Caroline. I'm Managing Director for Sandwell for the CCGs.
Great, thank you. So hopefully that's everybody. Great, okay, that's the first thing. So moving on, have we got any apologies for the meeting? I know we've had potentially Alison Knight's apologies given to us by Nikki.
Yes, Chair. We've got Councillor Crompton, Councillor Underhill, David Stevens, Francis Craven and Ian Green.
Fantastic, thank you very much. So we note those apologies, and if I could now please ask anybody to declare any interests. I'm not aware, certainly I don't have any, so if anybody has any interest that might affect the meeting, if you're able to declare those interests now, and I'll just pause for a moment. Okay, great. So no interest to declare other than those who are already on our register list. That's great. Moving on, if we could now go to the minutes of the last meeting. This is the minutes of our meeting held on the 30th September 2020. And just give me a moment and I'll try and bring those up if I can find them. So here we go. Just give me a moment. So minutes of the last meeting, 30th September, held virtually. I'll just go through those very briefly, so hopefully we can take them as read. So page 1, introduction, page 2, Sandwell position, page 3, page 4, update on the Community Engagement Board, page 5, safeguarding adults, 6, Better Care Fund, 7, reset and recovery, and that carried on 8, 9, Black Country merger, that's on the agenda, board forward plan, and that's the end of the meeting. So if I can take that as a true and accurate record, just been asked to hear if we can confirm those meetings a true and accurate record, and to propose Councillor Sheen seconds those as a true and accurate record. Is that acceptable to everybody?
Yes, I'll second.
Thank you very much, that's good. So moving through very well so far, let's hope it continues. And that therefore brings me, I could just also regarding the minutes that I can say that we did have an item on the Better Care Fund, and the Better Care Fund was brought up at our Sandwell Place-Based meeting and noted and approved by the Place-Based Board. So I just make that comment as it were as a matter arising. I don't think there are any other matters arising from the minutes, unless anybody is able to correct me. Just pause there for a moment. Great, assume then there are no more matters arising. That brings us on to our first agenda item, COVID-19 position and update on where we are in Sandwell. Over to you, Lisa.
Thank you, Chair. I'm just going to take colleagues through a few basic slides. Apologies to those of you who have already seen them today, including you, Chairman. And then I can answer any questions. We can also have a quick chat about vaccination if there are any questions about that. Apologies for my voice in advance. I've been in outbreak team meetings all day, so I'm rapidly losing my voice. So I'm hoping, can you see my slides now, Ian? Are they visible?
Yes, I can see them. Thanks, Lisa.
Lovely. Okay, so what I'm going to do is start here to save time. So the basic picture we have in Sandwell is a changeable one. So as all of you will be aware, the West Midlands as a region has seen rapidly rising infection rates certainly over the past 4 to 5 weeks in earnest. A few of us are near the top now of the national league table, if you like, in terms of infection rates. The last time I looked last night, I think Dudley and Stoke were second and third. I think we came in at about fifth, and then you've got Birmingham, Wolverhampton, Walsall following up behind us. There was a region we're going through probably our toughest part of the second wave at the moment. You can see positivity rates at the bottom there are rising. We're also testing a lot of people. So in the last week, for example, we've had about 8,500 people through our testing site. So we're doing well in that respect. And that to some extent will explain some of the higher numbers of cases, but positivity rates, and we think infection rates in general, are quite high in our region at the moment. However, they have been coming down, certainly in the last week, I would say in particular, we've seen a decrease in infection rates. And this is really what we think we're seeing is the effect of a couple of things. Firstly, it's the first knockings of the effects of lockdown. And unfortunately, we knew it would always be the case because of the time lag in terms of infection, incubation, presentation of symptoms, etc., and then testing time, that we would only really see the effect of lockdown as lockdown was coming to an end. It's only 4 weeks long. And so you can see a decrease. Also, we've seen some very successful communication campaigns go out in Sandwell in recent weeks. The feedback is that people have particularly appreciated and responded to quite a hard line in terms of communications. I suppose, to use a cliche, we've told it like it is in terms of the potential fatal nature of COVID-19 illness for certain groups in our population. So we've sent out a strong message, which is the feedback we've had has been recognised and heard, and the newspapers have been very good at responding and putting that message out for us. And people have said that they appreciate being kept informed, both in terms of the data and in terms of the meaning of that data. So I think that's a lesson going forward. So case rates are coming down. Breaking it down by town, Smethwick is currently the highest. For some weeks now, Smethwick was actually the lowest town area. And these things switch around, of course. What this graph represents really in terms of the last week or two is not so much which areas have been rising the fastest, but which have been slowing down the slowest, if that makes sense. Tipton has been our highest rate area for the last several weeks before this week, so a bit of a turnaround there. But in general, case rates are still very high, but have been coming down. Breaking it down further, you can see it's St Paul's ward, which is really stretching out in front, and we're doing some detailed epi analysis at the moment on St Paul's ward to look at the patterns of infection and see if we can see any particular source. We always do this when any particular electoral ward stretches out in front by a significant margin, which St Paul's has done in the last 48 hours. Usually we don't find a particular source, it's just a general surge in transmission, but we always look just in case. We study our outbreak records, we look at common exposure points, etc., crunch a lot of numbers and see what we come up with. And just to mention, this bar chart you can see in front of you, I tend to tweet it out and we put it on our website every day. It's very popular. It gives people all the information they need, and it was actually co-designed online with some local people. So following our preference, I suppose, for co-design in all things public health, even our statistical presentations now are co-designed by residents. There's the map. You can see red dots, which are the most recent cases all over the borough. And I want to spend just a second talking about this heat map. This is the thing that keeps me awake at night more than anything else in this presentation, is the top line there. You can see the case rates in the 65 and older age group. And of course, I don't need to tell any of my colleagues in the meeting that that is the group where we will see most severe illness and unfortunately most fatalities. So we watch that carefully. We've got a lot of work at the moment directly targeted at bringing the rates down among that group, including, of course, a a publication that has been sent out to every single person over the age of 60 in Stanwell via primary care systems. On ethnicity, I know people are often interested in ethnicity and case rates. It's still true that BAME groups, and in particular Asian groups, have the highest case rates. But what's been interesting over the last couple of months has been the surge in white British cases. And so I've presented the numbers of cases there rather than case rates, just to show you that at the moment we've seen a real surge in white ethnicity cases, whereas the numbers in the other groups have remained not so much steady, but rising at a slower rate. In terms of our response, you know, I could talk all day about our health protection response, and I promise you I won't. But just some main issues and measures from this week. Testing is around about 470 per 100k, which is the second highest UTLA in the West Midlands. Our contact tracing is at nearly 90%, 88% last week, which is actually by far, in fact, the highest UTLA in the West Midlands. And as many of you will know, we were the first council to actually provide our own in-house contact tracing service, and we've linked that up as one seamless system with the national test and trace system. And in terms of contact tracing, in fact, in the last couple of weeks, we've been visited by both the Cabinet Office and a number 10 Downing Street task force, because the plan is, and the hope is, that the rest of the country will follow the Stanwell model of contact tracing, which I think is a real testament to everyone who's been involved in that project, because it really hasn't been easy. Another thing they're interested in national government is our modelling work. So what we've done is we've been running algorithms and logistic regression models to identify the likelihood of the national test and trace successfully reaching certain groups of people. And you can imagine a number of demographic and other variables we've fed into that model. And we're working with the Cabinet Office now to make that algorithm and that model nationwide, because it could speed up the joint process really quite significantly. So that's the end of my slides, Chair. What I'll also do is say a little bit about the vaccine, if you'd like that. There are many others, NHS primary care colleagues, who will know what's going on with the vaccine as well. But we have a delivery programme running at high speed. Our primary care networks are going to be the lead agency on this, and they're already doing a great job in terms of pulling together plans for having the vaccination rolled out to as many people as we can, as fast as we can. Obviously, there will be priority groups in terms of course, NHS and social care workers, care home residents, those in receipt of social care, and in the community. The first group, other than that, will be our over 80s, because of course, as I've said before, that's where we see the likelihood, the greater likelihood of severe COVID-19 illness and death. So PCN is doing a great job, CCG doing a great job, and what we're doing is helping with the comms, the marketing, mobilising the voluntary sector to make sure they're playing their part in maximising uptake in some particularly hard to reach groups, and also of course helping the NHS source appropriate sites. So we put an offer out to the CCG that we can hopefully support appropriate sites for the vaccination to happen in. We'll also be working with the voluntary sector to help people get to those vaccination sites. Car ownership is quite low in Stanwell, especially in those older age groups, so we cannot be assuming people can drive halfway across the borough. So we'll be working on that as well. It's going to be a monumental effort that requires everyone's support and everyone's help. We'll be all right. We'll do it. We've got the right team together. So I'll stop there, Chair, and pass back to you.
Thank you very much, Lisa. That was a really helpful update. Just two things to mention. First of all, that as a CCG and local authority combined, I think that we can say that we are now well set up and ready to go as soon as the immunisations become available. We don't know yet when they will become available. We've been promised that they might be at the beginning of December, maybe the middle of December. All we can say is that when the vaccines do become available, we're ready to go to help ensure we start immunising all our high-risk people as soon as possible. We could talk about COVID and vaccine, I'm sure, for the whole length of the meeting. I'm keen to try and avoid too many questions. Whilst I don't want to stifle debate, I would certainly like to reassure all the members today, and it's always a little bit unnerving when you can't actually see everybody, that there are regular meetings held between the senior officers and council from local authority and CCG. We meet on a regular basis to discuss these figures and to just reassure you that we are keeping well abreast of things, and I'm certainly reassured that both the CCG and council, we are doing everything that we possibly can to manage this. And it's very encouraging that whilst rates are still very high, that over the last 3 to 4 weeks we can see there's been about a 20 to 30% fall off in cases, and that's very encouraging, and we can only hope that continues. So what I was going to do is I'll take one question from Terence, who's put his hand up. Other than that, if you've got any questions or queries to help try and keep the meeting moving, and I'm going to suggest we do this for all the items, if I could suggest that you direct any questions direct to Lisa or one of her team, and hopefully they can actually answer them far more fully than we might want to do in this meeting. So I'll take one question from Terry, and then we'll move on. So Terence.
Thank you, Chair. Just a quick question around what does the data tell us about what tier Sandwell may enter when the national lockdown ends on the 2nd of December?
Oh, I don't know if you want to answer that, Lisa. I was going to say that we don't know. We'll find out what Boris tells us tomorrow would be the best answer I could say there. My feeling is let's wait and see what happens tomorrow, because to some extent that decision is actually out of our hands.
Yeah. You're going to have to ask.
Say more than that.
You're going to have to ask the Prime Minister and Secretary of State that, Terence. DPH's chief execs, we don't get told in advance.
Thank you.
All I can do is to thank Lisa for all the work that she and her team are doing, and that everything is being done to get our rates down to ensure that we are in the lowest tier that we can possibly be in, and yet still safely manage the coronavirus problem. So thank you very much for that. So I think it's reassuring that things are bad, but they are getting better, and that's good news all round. So that's an update on COVID. We can move on now to Leslie and the Children and Young People Strategic Commissioning Partnership. We won't go through the paper page by page. It is a very long paper. I'm going to take, ideally, the papers as read, because we haven't got much time for questioning, but if you can just give us a brief summary, if that's okay, Leslie, on the Children's and Young People's Strategic Partnership update, and if we've got time, we can take a few questions. So, Leslie, over to you.
Thank you, Chair. Yes, in view of the time, this is a very long paper with lots of attachments as well associated with it. And I think at the time that we put this paper together, we didn't realise that this would only be a 10-minute item. So I'm not going to go through the slide set. They're included in your pack. I'm just going to pick out some highlights. Members may remember that back in March 2019, March last year, and the Health and Wellbeing Board agreed to establish the Children and Young People Strategic Commissioning Partnership, primarily in response to the 2017 Ofsted report that had a recommendation around the need to strengthen partnerships that were working together for children's services across the place, and particularly to ensure better coordination and oversight of the use of resources and decision making across Sandwell. So the establishment of this group was agreed, and we would have brought a report to the June meeting, but all of us were occupied with other things at that time. So this is, in a sense, a first year report. Some of the early work was around trying to remove a lot of the working groups, steering groups, partnership groups, activity groups, boards, etc., that were in place, and duplicating each other and not having effective join up. So you'll see in the report the governance landscape, which now positions the commissioning partnership in between the space that links the statutory boards, so Safer Sandwell, this board, the Health and Wellbeing Board, and the Safer Adults Board, the Children's Safeguarding Partnership and the Corporate Parenting Board, and provides that interface and that conduit between the statutory work and all of the other groups that exist to drive forward thematic areas. We agreed in the early stages of the partnership that this would be an alliance of commissioners and providers, and that we needed to construct a systems approach and really look at culture in terms of agreeing that systems approach and making it work. The priorities that were agreed for the first year were early years, emotional wellbeing and mental health, special educational needs and disability, children's social care, early help and targeted early help, and very importantly, the effective engagement of children and young people and their voice in helping to make sure that the right services were available to them, and workforce development across the system. So what you have in the paper is a set of information that describes the progress of work against each of those priority areas. I want to particularly pick out the work in early years. Our Early Years Transformation Academy has been particularly successful creating a single plan for systems redesign, from maternity services through health visiting, children's centres, public health, early learning, childcare, inclusion services, the whole gambit, and end-to-end system redesign. And we're now beginning to work on implementing that. And this has also been agreed as part of the STP arrangement for the Black Country. So we should expect to see some impact from that work over the next year. Just to pick out a couple of other things of note, the work around emotional wellbeing and mental health, our Thrive work. We've managed through the COVID period particularly to identify some extra resources for some of the demand management in that work, and we've seen the introduction this September of the new mental health support teams and the education mental health practitioners in schools. So that's been particularly successful. And recently, just I think it was last week or the week before, I've lost track of time, a scrutiny activity that was particularly looking at some of the work in the CAM space, and Marsha, who's on the call today, was in that call, and I think there was some very good developments from that call in terms of good work that's happening in that space. In our special educational needs and disability work, one of the important things this year has been the development of the Transforming Care programme and a dynamic risk register and education care treatment to prevent admission or support discharge planning for these children and young people. In children's social care, there's an important piece of work that's ongoing at the moment, and particularly around transitions for care leavers between children's services and adult services. And again, partners working very well together to make sure the right pathways are in place. Our work in the early help space and targeted early help has been particularly supported by the Early Help Partnership, which is a voluntary community sector-led partnership. And what's important about this partnership and the way that it can influence the strategic work is that cultural shift from hierarchical working into a networking approach to really support, enable, empower and facilitate the way that partners can work together. And we can see from some of the review work that took place in May of this year across the partnership that cultural shift towards a more integrated way of working is definitely felt to be happening by people working in our services. Importantly also is the work that's taken place around children and young people's engagement. So we do have now an agreed joint children and young people's communication and engagement strategy, takes us up to 2022, supporting a whole system approach to consulting and engaging with children and young people, and much more importantly, hearing their voices, responding to their voices, and going back to them to tell them what we've done in response to their contribution. The area of workforce development has seen us roll out the adverse childhood experiences awareness training through the Artemis module, our trusted adult training, and a lot of work in the space around trauma-informed practice and discussions ongoing with the VRU to become a trauma-informed place. So finally, thinking forward. I think a lot of success has taken place over the last 15 months or so around the partnership coming together, being more strategic, aligning resources, making sure we have a good authorising environment in place to remove duplication and really start to make a difference by doing the right things at the right time, in the right places together. So moving forward, the commissioning plan, the joint commissioning plan, will be produced with some clear measures, some starting points and some end points, so that we can come back here in a year's time and really tell the board what difference all of this activity has made. Thank you, Chair.
Thanks very much indeed for that brief and excellent summary. I think it is an excellent report. Certainly in the past, I know that we've been criticised quite significantly for the care and support we've offered to our children and young people, and it's great to see what a huge improvement's been made, and that we're now being congratulated for the work that's been done. And it's amazing to see what fantastic work's been done and what such a huge amount of work's been done. So thank you very much for that. What I'm going to suggest again to try and keep things moving on is, if all our speakers, if you could put your email address in the chat function. And there's one question there actually that Pre's asked of Lisa. You can put your email addresses in the chat function, and then if any members have got any specific questions, things they want to ask, then maybe if I suggest try, if it's a short question, putting it into the chat box, or if you want to email our speakers direct, that might be the best way to help take things forward and avoid getting too bogged down. So thank you very much for that. What it then actually now brings us on to is, as a Health and Wellbeing Board, that we need to note the report, to note the next steps required to transform services, to continue to receive reports from the Children and Young People's Commissioning Partnership, as we have done tonight, and to endorse its ongoing accountability to the Health and Wellbeing Board. So hope that as an organisation, those of us, we can now note the report, accept the report, thank Leslie and her team for the fantastic work that she's been done, and I'll just pause for a moment and hope that we're all happy to accept that. I'm hoping that no one is going to disagree, but I'll just pause for a moment. And that's great. Thank you very much indeed. Now, I know it seems cruel to say we're not allowed to ask any questions, but I think in the nature of a report like this, we could begin. This would be another report. We could be discussing this for the next 2 hours as well. So there's a lot of great work there, but if anybody has any questions or comments, then by all means, if it's short, put it in the chat box or suggest that you contact Leslie direct. So thank you very much for that, Leslie. That was great. That now moves on to, there's a comment there, so that moves on to the next item. This is Nikki Denston presenting on behalf of Alison Knight, and that's the update on the inclusive economy. So Nikki, if I can bring you in, please.
Yep, no worries. Thank you. Share my slides. I hope you can see those.
Yes, we can.
Okay, that's great, thank you. So I've come to speak to you today about community wealth building in Sandwell. Obviously, COVID-19 has had a significant impact on the economy, and I think just today the Chancellor's mentioned about the economy not getting back to pre-pandemic levels until at least Q4 of 2022. And obviously, the economy will have a significant impact on people's health. There is a distinct link between poverty and wealth. And last time, Alison Knight brought some information to you around the impact work that had been undertaken specifically in Sandwell. So there was some economic work that detailed some of the impacts, particularly on the self-employed, people that were furloughed, and the uptake in applications for benefits. So therefore, it's essential that community wealth building is used as a lever, really, to support Sandwell's economic recovery from the impacts of COVID-19, and also to build our resilience as a borough. What we have seen through the pandemic as well is a collaboration of lots of organisations and groups working together to support local communities. I've seen this firsthand being involved in the Food Hub. We had lots of organisations coming together. And this really is one of the heart of community wealth building, really. Its impacts are wider than just the economy. It's around social and environmental and health factors too. July 2019, we did a community wealth building seminar, and we invited lots of anchor organisations and voluntary sector organisations to come together to discuss community wealth building. After that, we asked the Centre for Local Economic Strategies, CLES, to come and do some work with the council on identifying where we were with community wealth itself. The diagnostic report that was done identified that Sandwell only spent 15% of its buying power with local suppliers. And this identified a real need for us to actually work a lot better with our local suppliers and our local companies. The Centre of Local Economic Strategies has got 5 pillars of community wealth that they assess organisations against, and these were the pillars that were used to assess Sandwell Council. What I've done in slide 2 that you can see is to look at those and link those to the Health and Wellbeing Board priorities. So the first one is procurement. So your priority around we will work together to join up services. As I've mentioned, lots of organisations have got together in the pandemic, and it's really shown the power of what we can do. What we want to do is to harness that power and use it to do a lot more within the community, and particularly around community wealth. Social value is a key element of that. We have social value elements within our contracts within Sandwell, but it's about making the most of those and actually identifying the things that we really do need that will make a definite difference to the people of Sandwell. Also around collaborative purchasing. A lot of the anchor organisations within Sandwell purchase a lot of the same things. Sandwell Council, the NHS, the CCG, they'll all purchase things, basic things like paper clips, paper. It's around us looking to get the best economies of scale, to do something collaborative together, to identify whether there are local suppliers that we can utilise that will bring that wealth into Sandwell. Second one was employment. And linking to that is your priority. We will work closely with local people, partners and providers of services. The skills deal, skills strategy is one of the major things that has happened during the last few months. And that really identifies opportunities for apprenticeships, work experience, helping people to develop the skills that are needed to develop the companies that we need in Sandwell. And a good employment charter. What we're looking to do is to bring organisations together to look at what employers should really be about, and actually identifying some real key things that we can work on together to ensure that people who are employed in Sandwell really with good employers. Land and assets. So this links to we will help keep people safe and support communities. So we're looking at our development of underutilised assets, potentially for community use. So we've got lots of assets across the council and across other anchor organisations. It's about how we can use those, particularly those that are underutilised, to support community groups and the voluntary sector. And so that can help then build communities and build resilience. Fourth one is financial power, linking to we will work closely with local people, partners and providers of services. So this is around harnessing that local wealth. So making people be more aware of local spend, showcasing different organisations locally where we, local shops and local businesses, where actually we can retain that wealth within Sandwell rather than the wealth going out. And looking at things like different forms of community ownership, how can we make sure that there's different models out there, supporting the voluntary sector, building their capacity and their capability, so in effect they can deliver services for Sandwell residents in the future. Democratic ownership of the local economy is the final one, and that links to we will help keep people healthy for longer. We're exploring at the moment things like feasibility of developing an energy company, local decision making on local priorities, improving levels of community throughout Sandwell. The next one is building wealth to improve health. So as I mentioned earlier, poverty damages health and poor health increases the risk of poverty. But by increasing and retaining wealth with the communities of Sandwell, it will have some real impacts on health. It will support the reduction of living in day-to-day poverty. And we do know that day-to-day poverty can have real impacts and consequences on people's long-term health. It will allow people to access the basics that allow them to fully participate in society. As part of the Inclusive Economy deal, we did a survey of residents, and one of the major things was around accessing opportunities was that they haven't got the money to travel to particular jobs or to training courses. Hopefully this will help to stimulate that. ensure healthier behaviours can become more attainable, and more healthy foods and exercise. Community wealth building and resilience governance. So we've developed a new strategic partnership for Sandwell that focuses on the borough's long-term recovery post-COVID-19 and builds our economic resilience. The membership, we've got key strategic organisations from across Sandwell. Some of you who are here today, including the NHS, CCG, West Bromwich Albion, we've got the police, we've got obviously council. So we've got the real key anchor organisations as part of the board, and the board is chaired by Councillor Rajveer Singh. The purpose of the board is to identify emerging opportunities to achieve recovery and prosperity, and then this is supported by an officer group to deliver those actions. We've developed a delivery plan where a key focus is on increasing and retaining wealth in Sandwell. What we want to do is to look at the real opportunities, so look at things like the regeneration, the Towns Fund, how we can create better employment opportunities and more employment opportunities. As I've mentioned, increasing the capacity and capability of the voluntary and community sector and supporting young people, particularly around gaining access to skills and employment. Also, all of that will have positive health impacts that we need to make sure that we build on. We've also developed an anchor network. As I've said, we've been working with the Centre for Local Economic Strategies, and they've put in a bid to Barrow Cadbury to develop a Sandwell anchor network. There is already an anchor network located in Birmingham, and Barrow Cadbury are keen to support that Sandwell can do the same. The initial work that's been carried out by the anchor network is to map out the anchor institutions in Sandwell. What we've done differently from Birmingham is Birmingham looked at the amount of employees an organisation had and actually their turnover. So that's why they've got some real big private organisations as part of their anchor network. What makes us unique from other anchor networks across the country is that we wanted to do it based on the contribution that an organisation makes within Sandwell and their impact to the economy. So I know Mark Davis is here today, and usually with the Birmingham model, some organisations like SCVL wouldn't be included, but actually they play a significant part within Sandwell, and that's why we've included some of those types of organisations, such as Albion Foundation, who've worked really tirelessly with us during the pandemic. We think they have a real contribution to make. We are developing a draft anchor network charter, and we're looking at the moment to gather a commitment for joint working through that. We don't want this to be a paper exercise. We want to make sure that anchor organisations sign up in reality and help us to deliver some real positive contributions. To kick off the anchor network, we actually had our first anchor network workshop last week, which was really well attended and focused on 3 areas: progressive procurement, economic regeneration in Sandwell, and business support. The anchor workshop went really well, and we've got some real key ideas that we need to move on, and some of the key themes that came out of that are around a mentoring programme for young people, supporting disadvantaged groups to access opportunities such as volunteering, jobs and training, a whole common approach to social value across anchor network, setting joint targets for local spend, promoting mental health training and first aid training across organisations, and improving digital skills training. And I think all of those will have a benefit on the health impacts for Sandwell. And on a final note, we've also joined the Community Wealth Building Alliance. This is an organisation where 250 public and private sector organisations and 17 local authorities are getting together to lobby the government to release dormant stocks, shares and bonds to create a £4 billion endowment. The Community Wealth Building Alliance has looked at some of the local authorities across the country and identified some that are classed as left behind. The terminology might seem negative, but they have been in consultation with lots of residents across the country. Rather than disadvantaged or things like that, they wanted to be called left behind. Sandwell has 3 left behind communities, and that's been developed using a COVID-19 vulnerability index, and that's based on health inequalities, underlying health conditions, economic vulnerability and mental health. And that's identified Hatley Heath, Langley and Prince's End. If it's successful and the government provide the £4 billion endowment, it's anticipated that communities will be given a sum of £2 million to actually use in those areas. And it will be those communities that will have that local decision making to determine what they want to do with it to improve their actual community and their neighbourhood. And that's my presentation. I'll take any questions in the chat.
Thank you very much indeed, Nikki. That was really helpful. I appreciate it because time is limited, so I'm not going to be able to take any questions. But if you could put your email address in the chat box, Nikki, and if there are any questions, then I suggest that if you contact Nikki direct, I think we'll find. I know the presentation quite well, but interesting, a lot of what you said, Nikki, will actually start to come through in Lucy's presentation later because the two are linked. If we can work together and we've got a healthier population, then often a healthier population becomes a wealthier population. I know that our major trust, on the West Birmingham Trust, is already a living wage payer, which is great because it's beholden upon all of us to try and become living wage payers when we can. That's sometimes easier said than done because it's often we ourselves may be paying the living wage, but of course it's often sometimes people with whom we might subcontract. It's trying to make sure that all our subcontractors are also living wage payers, and I think it's important that we all try and strive for that to be our aim. So it's really positive that we're trying forward to make ultimately Sandwell a healthier, wealthier and a better place to live in. So thanks very much for that, Nikki. If you can put your email address in the chat box, and if anyone wants to make any brief comments, then please do so through the chat box. We're just now asked, of course, to make a recommendation. So the recommendation from this paper is that the board considers that the council's approach to community wealth building in Sandwell fully supports the priorities of the Health and Wellbeing Board, which I feel it does. So I hope that we are all in agreement with that. And I'll just pause for a moment. And I hope that we are all in agreement. So that's fantastic. So yes, we can say that we've got a unanimous agreement in that. So thank you very much, Nikki, for that. Thanks for putting your email address down. That brings us now to the next item agenda. We've actually got a specific presentation, but Chris, over to you for an update on social prescribing, please.
Thank you, Ian. Yes, I think as Terence mentioned earlier, I think we're going to do a bit of a joint effort on social prescribing. So I'm going to start off and explain a little bit about what social prescribing is, and then Terence will come in and talk about how it's being rolled out across primary care in Sandwell. So I think it's fair to say that social prescribing isn't new. It's been around forever. The language might be something that we're not used to, but the concept we certainly are. It's about how we work with people in their communities to ensure that they're connected to their communities and that they can access the practical and the emotional support that they actually need. And I think we do that, and we always have, in so many ways, being good neighbours, local grassroots groups that can support local people, as well as the wider voluntary and community sector that we all value, I know, in Sandwell. So it is about supporting people to be as active as they can, but also to be proactive in enabling them to have positive health and well-being. And by building the resilience of the individual, hopefully we can help to support the community to become more resilient, and our whole system then is more resilient going forward. And I think it's fair to say that the focus is on one question, really, when we talk about social prescribing, and it's what matters to me. And I think that cuts through all the jargon, and it gets down to the real personal position that someone is in, and asking that question of what matters to me at this point is where we need to be to start to move social prescribing forward. So we are trying to make sure that whatever we do in Sandwell, we do it with partners. And I think it's really clear that we've got 3 elements that we're working on, and we're trying to pull all of those together to have the maximum impact for Sandwell residents. So the council and the CCG, through Better Care Fund funding, launched the community offer in April this year. That's an investment of £2.8 million over a 3-year period. And already through the COVID pandemic, we've supported over 1,100 people who are living in communities with real practical support, help with shopping, making sure that they can access the benefits, making sure that they can still maintain contact with their friends, relatives, neighbours, and making sure that we've supported also the welfare hub, where people who've been particularly clinically vulnerable have been able to be referred through, and we've been able to offer that really practical support. From a public health perspective, they've developed a Stronger Sandwell directory, which is used by social prescribers to actually access support across the borough. They've had a real focus on carer support through the pandemic, but they're also looking at the Healthy Lives work stream, which is about actually looking at employing health coaches that will work within GB practices to try and support people to stay active and to stay healthy. And now if we move on to the particular scheme that we call in social prescribing, this is in primary care where there's funding that's available, and I'm going to pass over to Terence now, who's going to give you some more details about that.
Thanks, Chris. Thanks for that. So yeah, just to set some context, NHS England, probably about 2.5-3 years ago now, started to co-design across the whole country, working with partners up and down the country, a national model around, and they essentially established some key ingredients about what you'd expect to see in any sort of form of social prescribing scheme. The link worker funding for social prescriber link workers within primary care networks is funded through what's called the Primary Care Network DES. It's through a reimbursement scheme where primary care networks are able to draw down funding for link workers for their primary care networks. So the CCG itself isn't commissioning link workers, it's done through the Primary Care Network DES. We are, though, a conduit for that funding, so we verify the funding, we make sure it's all within the kind of expected spec of a link worker, that it fits well with what Sandwell needs in terms of social prescribing, the job descriptions are appropriate, and that the investment being made for each of the roles is befitting of a link worker. There's a load of work done as well since the funding was made available last July around working with all partners to support the development of link workers in terms of their skills development and developing their knowledge and confidence as well. And then also a lot of advice and guidance around social prescribing models and their implementation as well. For clarity as well, there are some expectations placed upon primary care networks as part of getting that funding. They do need to take a role in assessing the needs of their local populations, who identifying who would benefit from targeted proactive support. And they've been working in partnership with us as well to develop joint social prescribing plans, which build on existing social prescribing schemes or something that would be called that. But also fundamentally make sure that it embeds link workers in the primary care networks and the communities that those PCNs serve as well. I can share some slides after this, but the timelines are, Chris mentioned the community offer went live in 2020. The funding for social prescribing link workers was made available in July last year. We held in the build up to that, I think 3 engagement events and the build up to that to look at how best to kind of develop those shared local plans as well, for a combination of something that we hosted and we hosted through BCF as well. The link workers themselves, there are currently, as of this month, almost 8, so 7.5 whole time equivalent link workers employed across 8 primary care networks, and they're either employed internally or subcontracted through an external organisation. There's probably 3 key themes that all of those link workers have. They all focus on the strengths and assets of people that they serve, building on people's confidence to help them take control of their health and well-being. They all work in partnership with people to listen to what their needs are, again looking at what matters to them from a holistic perspective. And then the third thing they do is that they are essentially focusing on the wider terms of health and well-being to try and come to terms with any kind of barriers that are getting in the way of their actual physical health and mental health and well-being. And they'll come up with a kind of what's called a personalised care support plan as well to do that. Chris mentioned the investment that's been made as well already for the BCF funded community offer. The link workers, the salary costs are all covered. The NHSE funds are all covered for that. So 100% of the costs associated with recruiting a link worker are reimbursed, and that equates to around about £35,000 per link worker. So what's the impact we've seen so far? We are in the position where we are getting data, because all of the contractual arrangements are managed through the primary care network DES. But we do speak to our link workers on a regular basis through regional forums and through local forums as well, when we are giving them support and advice and guidance around getting them embedded. And there's probably three key areas that we look at. We look at in terms of the impact on the person, the stories we get from there, the community, and the impact on the system as a whole. No, I think COVID has definitely brought to, it's made it very, very visual in terms of the impact that I think workers have had. They've done a lot of work, even before COVID came around addressing isolation. But that's become more profound, I think, during the COVID outbreak. And they've even been looking at things like ensuring very vulnerable residents have access to food parcels and medical supplies, which has been very, very important, especially in terms of access to primary care during the outbreak. And generally, just building people's resilience to make sure that they've got the coping strategies during these struggling times. From a community perspective, they have done their bit to work in partnership with others in the voluntary community sector to build people's resilience, to contribute towards neighbourhoods' well-being and their resilience towards that. And just generally increasing awareness of what is happening in the community. That's something not just link workers have done, but that's something that I think everyone has played their part in really, really well. And then from a system perspective as well, I think what we've seen now is lots of really good feedback from, especially from GP practitioners and other people in primary care, about the profound impact social prescriber link workers have had, especially in terms of trying to facilitate access to primary care during the COVID outbreak. We saw that big shift away from face-to-face contact, where people felt incredibly isolated, and in many cases we're dealing with non-medical needs. So I think workers played a really handy role in that. I'm going to hand back over to Chris, who's going to talk us through next steps and priorities that we've identified.
Yeah, we just wanted to give some simple messages really about how we intend to move this forward now. One thing that we have agreed is that we need to evaluate the range of programmes that we have around this whole social prescribing agenda. So we don't intend to do an evaluation of each individual project. What we want to do is a whole system evaluation, and we had plans around that before COVID hit. We need to make sure that we've picked those up now. I think the other thing that's really important is that we continue to work in partnership and to join up the links between the number of schemes that are out there, so that we're getting maximum benefit for the investment that we're actually making in our system across health and social care. And we can do that through a number of routes, through the MDTs at a local level, working through the emerging ICP, and making sure that we support people to maximise their own individual health and wellbeing. And I think finally, Terence has touched on it really. We want to continue to focus on overcoming social isolation and loneliness, particularly around recovering from this COVID pandemic. So we are absolutely committed to making sure that we're there on a local level for the people in Sandwell going forward. So thank you for your time today.
Thank you very much, Tess and Chris. If you're able to put your email addresses in the chat box, and then if people want to contact you direct, what I would say is that from a GP perspective, I would say it's one of the most effective parts of investment in general practice ever. My own practice are desperately keen to try and employ a second social prescriber, and maybe even use some of the resource that we've got in other areas for that. And there's a little vignette. I know that my own practice had a patient who was a housebound patient who was calling the practice probably 3 or 4 times a week. Huge amount of resource. We sent the social link worker in and actually said, why are you ringing the practice? Because you've been doing this for 18 months. We're also not sorting out your problems. I think essentially the problem was she was lonely. She needed someone to do the shopping. So we sorted out the loneliness. We sorted out the shopping. In fact, subsequently she became able to go out, and she was calling for visits about twice a year. So the link worker went in, and actually not only did we solve her problem, it actually saved a huge amount of medical resource, and it was a win-win all round. So this is one of the best investments that I think we can make in primary care. So thanks very much. That's really helpful. So that takes us on to, if you've got any comments, then please contact either Chris or Terence direct. Brings on now to Lucy, and working together for a healthier post-COVID future, and how we can start to help to address some of our health inequalities. So Lucy, if you want to go to your presentation, please.
Yeah, hello everyone. Thank you for letting me join you today. Can you see my presentation there on the screen?
Yes, we can now. Thank you, Lucy. Yes.
Brilliant. So I'll go through this very quickly. I've put in the chat box the link to the full report, which was also in your papers, and also a link to a Survey Monkey, which would be really great if anybody has a chance to provide feedback on the questions at the end, or if you prefer, feel free to contact me on my email address, which I've put in there as well. So just to give you an introduction, this is about the Wider Determinants of Healthy Life Expectancy Programme, or WHOLE as our acronym. And this is a programme that's being done in a number of phases, and the first phase has been completed, and the report is the Working Together for a Healthier Post-COVID Future. So I'm just going to share the information from the report, but this is only the first phase of the programme. So the purpose of the programme is to really help local partner organisations better understand their populations in terms of the interactions between the wider determinants of health for people and people's actual health. To develop a set of priorities for action, and to do that through engagement with relevant stakeholders and community groups. And then the next phase will be about co-designing and collaboratively implementing and evaluating projects that have the potential to address those wider determinants of health and therefore facilitate improved population health. So the report is based on a model looking at the relationship between socioeconomic status and population health status and our healthcare delivery. So we know that the wider terms of health impact on our socioeconomic status, and that this is cyclical, and therefore vice versa. Our population health status impacts on our ability to work, to earn money, and on our housing, etc. And then we know that our population health status then impacts on our healthcare delivery, so the amount of demand for our healthcare. And our healthcare delivery has an impact on our population health status, but also that our healthcare delivery and the way we organise and the way we employ people can have an impact on the socioeconomic status of our local populations. And then added to this, COVID has come into the mix, and this has impacted on all three of those elements. So we have direct treatment impacts of COVID-19, there's the enduring health impacts on our population health status, but there's also the socioeconomic impacts. And that's where we will kind of focus today. So we've undertaken some modelling. So this uses the 3 economic scenarios developed by the Office of Budget Responsibility. And we use these and link them to changes in unemployment they predict, to changes in health condition prevalence based on research from the 2008 recession. And then we model the potential demand pressures resulting from those changes on both physical health services and on mental health services. And these graphs show the output of that modelling. So you can see for physical health in those 3 scenarios, we'll expect a peak either in 2020 or 2021. And in the worst case scenarios, that won't return to pre-2019 levels. And then if you look at the impact on mental health, you can see that's even more extreme, that we'll expect a peak in 2021, which could suggest up to 25% higher activity for mental health services, and even by 2024 in all 3 scenarios that won't return to pre-2019 levels. So this is something that we really need to prepare for. And some of the opportunities we might have for action, and this links back to Nikki's presentation earlier, is around the NHS and other partners acting as anchor institutions. So that is the things that Nikki was referring to earlier, such as widening access to quality work, purchasing more locally for social benefit, supporting our communities through our buildings and spaces, working more closely with local partners, and reducing environmental impact. And as part of the report, we gathered case studies on this from each of our NHS organisations, and there's some really good examples of our NHS organisations acting as anchor institutions. But I think that probably the key thing that came through is that we're not doing this systematically across the Black Country and West Birmingham. We're doing this in pockets, and there's a real potential for people to learn from each other. So the example that Ian mentioned earlier about Sandwell and West Birmingham Trust paying all its staff at or above the living wage, they were the first trust in the Black Country to do that. Walsall is now following suit, and we're exploring that in the other places as well. So the point of this presentation and the full report, and I'm sorry that's been such a quick overview, but we didn't have long on the agenda, is to do 2 things. One, to kind of raise awareness about the wider determinants of health and the impact that has on people's health and the additional impact that COVID will have, but also to ask for your input into a report we're going to take to the Healthier Futures Partnership Board at the end of January. And so on that point, I have 4 questions, and I know we won't have time to discuss them today, so I put the link to the SurveyMonkey in the chat box and my email address if you prefer to contact me that way. So the first question is, what priority should be given to each of the target socioeconomic outcomes and why? So the diagram shows the links between better school readiness, better skills and qualification, fuller employment and better jobs and higher incomes, and so on. Or there might be other target socioeconomic outcomes that you think are important. Secondly, are there specific population cohorts that our whole system action should focus on? And that might be in terms of age groups, gender, ethnicities, deprivation levels, or other cohorts. And then the third and fourth questions, we've kind of identified through the report those target socioeconomic outcomes and potentially the potential intervention mechanisms that were linked to those. So the first thing is, do you think there were any additional intervention mechanisms should be considered? But most importantly, I think, are there any specific candidate interventions that you think should be considered? So any actions you think we should be looking at as a system that we can start focusing on in phase 2. So I'm going to finish there. There's the SurveyMonkey link again and my email address. And the full report, like I said, is on the Academy website, and that link's in the chat box. I'd really appreciate any feedback through either of those routes. Thank you very much.
Thank you, Lucy. That's really, really helpful indeed, and incredible food for thought. I was just thinking about it myself, and actually that's a really succinct presentation. Is you look at question 1, you look at all those things: greater school readiness, better skills, fuller employment and higher incomes. They're all incredibly important. Incidentally, I did read somewhere, I can't remember the source, but it said that by the age of 5 or 6, almost which road you're destined to take has almost been made. So if you've taken the wrong road, you're in a poor family, you've not been taught to read, you don't exercise much, almost by the age of 5 or 6, you're almost determined then how you're going to end up in life. So but I would almost pick that greater school readiness, that if we can get people really ready for school at that stage, then that has a huge impact on life, that it really does matter starting at a very, very young age indeed. But it is a massive challenge. And I would just encourage everybody to think about this and send your comments back to Lucy. It's a huge area, it's a massive challenge, but we've got to start somewhere, and if we can make even a small difference, then that's going to have a massive impact. Maybe just one food for thought is, I can remember reading somewhere one of these documents says it's almost impossible to improve one thing by 100%. But if you can improve 100 things by 1%, then we can still make the same difference. So maybe that's also some food for thought. 100 things that we can improve by 1% would actually still make a massive difference. So thank you very much, Lucy. Please feed back to Lucy direct, or you can always feed back to myself if that's more helpful. There's the link in the chat box there. And at that point, I'm now going to move on to Leslie again. So this is now the Children's Safeguarding Board Annual Report. So back over to you, Leslie.
Thank you, Ian. In view of the time, I think rather than sharing the slides, I'm just going to briefly speak to the set of papers that you've got, if that's okay. The reason the annual report is coming here is that the changes to Working Together to Safeguard Children in 2018 have meant that 3 relevant partners have equal responsibility for the safeguarding of children in any place, and those 3 relevant partners are the CCG, the police and the local authority in the place. So the 2019-20 annual report that you have is the first annual report that is relevant to this board, the Health and Wellbeing Board. So what you'll see in the report was that there are a range of priorities for 1920, and you'll see how those priorities have been addressed and met during the year, including contracting an independent scrutineer to come and look very closely at the work of the partnership and to provide findings, and you'll see a set of actions that were in response to those findings and some progress for those actions in 1920, and some of those actions have continued into this year, 2021. We've rationalised some of the groups again and some of the activities and work that were happening around the previous Safeguarding Children Board. And we've also managed to move from a system of old serious case review arrangements 2 new safeguarding practice review arrangements that link into a national panel, and also the transfer of arrangements at a local level to manage child death overview arrangements into a new Black Country child death overview panel arrangement. And both of those transfers have worked very well for us. I'll just pick out the priorities moving into 2021 that come out of the annual report. There to make sure that during 2021 we carry out full audits through Section 11 requirement and a Section 175 requirement for all partners to complete a full audit of their safeguarding children activities and work. That is in train at the moment. We have a new monitoring tool to make sure that we're satisfied that the effectiveness of local services can be met. There's a new performance framework in place. Again, seeking the views of children and young people about the work of the partnership. The priorities in terms of thematic areas continue to be neglect and exploitation, but there are some other priorities also that have emerged from some of the safeguarding review work, and that's particularly for us to focus on babies and infants, work with fathers, and looking at cultural diversity and our understanding of diversity when making assessments about children and safeguarding. And I just wanted to make reference also to some of the work that's been happening through the partnership since the pandemic, because I think it's particularly worth noting the way that partners have worked together has been absolutely superb, starting with weekly meetings in April right the way through to September, the sharing of business continuity plans, being able to support each other and step into spaces that where partners could see there might be gaps. Take immediate actions to respond to high-profile campaigns to keep children safe, the surge planning that's taken place, and also that ongoing challenge and accountability across the partnership. From September, our agreement was that there would be 6 weekly check-ins around the business continuity planning and surge planning. We haven't seen the surge emerge yet, but I think it's likely to start to be evident probably the other side of Christmas. Obviously, the impact of the pandemic on children's well-being will probably be emerging for quite some time. But essentially, that's in a nutshell the annual report, and I commend it to you.
Thank you very much indeed, Leslie. And it, to some extent, follows on what we were saying earlier, is that it's a hugely important piece of work. We have been challenged in the past. It's great to see that there's been such a huge improvement. Sadly, of course, one of the fallouts of COVID is that domestic abuse indirectly, of course, affects children. And, of course, not only has domestic abuse gone up, but child abuse has also gone up. So, sadly, what has already been a challenging area is going to get even worse. But it's nice to know, it's very reassuring that we've got systems in place that are much more able now to help to tackle this problem. So thanks very much for that succinct summary. So we've talked about the key discussion points. This is the first annual report that's been published since the implementation of the new working together arrangements. And as a health and wellbeing board, we're now asked to note the annual report, to note the priorities for 2020 and 21 and beyond, particularly taking into account, of course, COVID, and you should continue as a health and wellbeing board to provide relevant support for and engagement with the Sandwell Children's Safeguarding Partnerships. So I'm just going to pause there for a moment, that hopefully we do all acknowledge the great work that's done and are happy to continue to support the work that's being done ongoing. So I'll just pause there for a moment. Thank you very much, everybody. So we note and take that as read. That's really helpful. Thank you very much indeed, Leslie. And that concludes the main discussion items. That brings us on to the next item of the agenda, very appropriate as we move forward. And if I can bring Michelle in now, and this is to look at how NHS 111 is changing. People may have heard the phrase "talk before you walk," and this is now how this is starting to become more of a reality. So if I can pass on to you, Michelle, and if you can just give us an update on how 111 is changing. Thank you, Michelle.
Yeah, so this is really just to update colleagues on the new plans. I am going to take the paper as read. I'm not going to go through every item, but in essence, the the major change of process here is that rather than turning up at ED, the national programme is now going to be that you'll dial 111 first, so a talk before you walk principle. This has been piloted in elsewhere, and even prior to COVID, we were seeing extreme challenges in our ED departments. So something radical was felt to be required. So this has been the preferred option, and as I say, it's been tested in some other areas. So there'll be appropriate caveats such as time slots and appointments, so that that is managed. But we felt that during these peak months of COVID, emergency departments have really been massively impacted, particularly around those, with minor illnesses that could have gone elsewhere. So we're hoping that this will have a really huge impact, a positive impact on how that will make sure that the most poorly get access to the right care, and those that can go elsewhere do. But I'm not going to go through any of the other elements, so I'm going to take it as read. I'd rather open it out to questions in case anyone's got anything that they'd like to ask or query.
In view of time, I'm happy now to open it up if there are any questions or queries on this report. It is important, it's something that impacts on all of us, and it's also fair to note that this doesn't mean that the 999 service stops, that if any of our patients are concerned that they have anything serious, that we would still actively encourage them to dial 999. This hopefully actually makes the service better and not worse, and actually helps to make sure that people get seen by the right person first time, rather than just turning up in an emergency department where they might end up at seeing the person that isn't the right person for them. So are there any comments, particularly either myself or to Meshel, we can try and answer? Oh, in fact, I've just noticed I'm a guest speaker to a meeting on the 17th of December, so thank you for reminding me about that, John. So there is another meeting, as John's put there, on the 17th of December at 10:30, and we can update you further then when we'll actually have some idea of how the system is progressing, because I believe it's actually starting or not really going live in our area. I know it's gone live in Hereford already, but I think it starts officially on the 1st of December. Is that right, Michelle?
Yes, that's right, Ian. It's supposed to be implemented next month, so it's so imminent. But yeah, Worcester's already gone live. For the question in the chat, it's not a pilot, no.
I mean, it's partly to try and streamline the service, and it's also partly brought in with the impact of COVID, with such a huge impact on the 111 services, trying to make sure it's streamlining. It comes back to the fact that many problems can be sorted out sometimes over the phone. Certainly many people do not need to attend an emergency department, and it's making sure that those people get seen by the right person first time. So I'll pause there. If you have got any other questions, I can put my email address in the chat box, or you can email Michelle direct. So Michelle, if you want to maybe put your email address in the chat box. Thank you very much for that. That brings us on to Councillor Sheen. You wanted to make a comment?
Yeah, I just was going to say that, where we mentioned when this meeting is taking place, if that can just be sent out to all members, just in case someone's interested to join then.
Yeah, I'm sure we can do that. Claire or Shane, can we ensure that happens? Oh, and John's put yes, we'll do that. That's great. Thank you very much.
Okay.
Thank you for raising that. That brings us on to the next item, which is my own. That's the update on the CCG merger. I'm sure many of you are aware that we came to, there have been many stakeholder events looking at how we as a CCG, that's Sandwell West Birmingham CCG, we're looking to merge with the other three CCGs. That's Dudley, Wolverhampton, Walsall. A vote has taken place, and all four CCGs voted overwhelmingly for a merger. That went to a special governing body where it was noted and approved. We've applied to NHS England for merger, and I'm pleased to say, although there are one or two, there's a lot of work to be done, we have now received confirmation back from NHS England that our application to merge has been accepted, and therefore we as four CCGs will be merging from the 1st of April 2021. A huge amount of work to be done. It's a huge amount of work and change for all those within the CCG. However, I hope as you as residents and patients of the area, you will actually notice very little change. I hope that in fact as a result of the change, it will allow us to become a more efficient organisation and potentially therefore actually free up resource to invest back into healthcare and therefore hopefully improve the service that's available for all our residents and patients. So just to confirm that the four CCGs within the Black Country West Birmingham will now be merging, and we will be one merged organisation with the very new and original title of the Black Country and West Birmingham CCG, and that will be as of the 1st of April next year. So there may not be any comments regarding that. Hopefully for most people it will make no impact whatsoever. And I'll just pause for a moment there. So that's great. So thank you very much. That was just an update on that. And then the final item on the agenda we've got is the board forward plan. It just says here the interim Health and Wellbeing Board Project Officer. I'm taking that. Is that Claire? Is that you?
That's myself.
Okay. So can I bring you in there, Claire, and whatever we need to discuss regarding the forward plan?
Okay, so we've got 4 items provisionally on the agenda for January's board. They are the Sandwell Carer Strategy for Stuart Lackenby, suicide prevention for Chris Guest and Alex Quarry-Jones, improving the palliative and end-of-life care work stream, which is down for Dr. Anna Luck and Sunny Patel, and a health protection board update from Lisa McNally. So if those are still relevant or if they need amending at all.
I would say that they all are extremely relevant indeed. Maybe we need some even updates from some of the items that's going on. Are there any other items that members feel need to be put onto the agenda? We've still got time. If there are any items, then please let either myself, Councillor Crumpton or Claire know. But I would agree that all those are very important items indeed. If there's any significant update on the merger, I can always bring that to you all. Care is still relevant. Message from Stuart there. So yes, so those are the main items. So thank you very much. That brings us actually to the end of the meeting. I thought that we may well be running late tonight, so I apologise that we've maybe stifled debate, but there's a huge amount there and probably not the right forum for an easy debate anyway, but all the members who've contributed have put their email addresses down, so please do contact them. I'm sure they're more than happy to be contacted. If you've got any questions, concerns or information, please do fill in the Survey Monkey for Lucy Heath's survey. I think that is really important indeed. Thank you very much, Michelle. So we have come to the end of the meeting, finished a little bit sooner than we thought. Just allows me to say that our next meeting, which will be a Teams meeting again, is on January 21st. And that's a Wednesday, 21st of January 2021 at 3 p.m, so 1 hour earlier. So thank you very much, everybody, for attending. Look forward to seeing you again in 2 months' time. Thank you.
Yeah, good meeting, everyone.